Welcome to the On the Pen, the weekly dose podcast, your one-stop shop for obesity medicine news with your host, Man on the Pen, Dave Knapp. Welcome to On the Pen, the weekly dose podcast for this Tuesday, July 1st, 2025. Can you believe it? July 1st, 2025 already. Unbelievable. And we've got a ton to get into today. I can't wait to unpack it all. We've got some information about helping you stay on Zepbound if you have lost coverage through your insurance company. There is a tool. I can't wait to bring it to you. This tool was created for this time, for this purpose. Can't wait to bring it to you, especially if you're somebody who lost Zepbound coverage through CVS Caremark. We've got some great news about the use of semaglutide in treating Alzheimer's and dementia. We've got some Viking Tide news, and we've got even a little bit of news this week about food noise and how Zepbound interacts with these signals that are happening in our brain. We actually have some scientific data to back up this whole concept of food noise, which is super exciting. But just to jump right into it this week, I've got some really awesome news, an awesome tool that we are going to tell you about today. So starting today, which is July 1st, CVS is dropping Zepbound from its preferred coverage list and moving to that spot, Wegovy instead. That means millions of people, probably hundreds of thousands at least, across the country will be steered away from the stronger, more effective obesity medication of Zepbound, not because their doctor said so, but not because of better results, but because basically a suit in a boardroom at CVS Caremark decided we'd rather strike a deal with Novo Nordisk and make a little bit more money off of these people living with obesity. So Wegovy is now their preferred, but this is not the end of the story. And I'm super excited to introduce you to a new tool and a new company that might help you. They have an 80% track record of helping people get coverage. I'd like to introduce you to Claimable. So we're going to turn our attention today to the elephant in the room, the fact that hundreds of thousands of people have lost access to Zepbound today, basically because a PBM, CVS Caremark, decided that they want to switch you to a medication that they make more money off of. That is the bottom line of why this change has happened with CVS Caremark. And if you got one of those letters, it was probably terrifying. You didn't know what to do. We kind of gave you some tools here at On the Pen on how to fight that. But what I learned in that process was that people were overwhelmed with the process of having to fight their own appeals with insurance companies. And it was shortly thereafter that I was introduced to a really interesting company that's actually been fighting insurance companies for several years now in terms of helping people stay on the medications that their doctors want them on. That's our biggest frustrations with PBMs, right? Is that they are always practicing medicine instead of just doing their duty and being the payer, right? So I was introduced to this company, and the more I learned about them, the more I fell in love with them and realized that the tool that they have made was actually made for this moment. So we're going to bring in our friend Zach Vegalis from Claimable. Zach, welcome to On the Pen. Why don't you tell us a little bit about what you all are doing over at Claimable and why the tool that you have developed is so timely today?
Yeah, thanks so much, Dave. Thanks for having us. So, I mean, it's obviously we're thinking of everybody that's affected by the switch that's going into effect today, right? There's an estimated 200,000 plus patients that are losing access to Zepbound starting today. So, our hearts go out to them, and ultimately, we just want to communicate that you have rights, you can appeal, and we're here to help, and frankly, take the guesswork out of it.
Yeah, so I know a lot of people have been panicking about this, and it's what I try to tell people, that this isn't new for the GLP-1 community. This is a problem that has existed for a long time in insurance. It's just that many of us are feeling it for the first time. This whole idea of PBMs practicing medicine. Can you tell us a little bit about what Claimable's track record has been prior to obviously this issue popping up. You're like, hey, we've got a ready-made solution for this. But tell us a little bit about the track record that Claimable has had in helping people prior to today.
Yeah, absolutely. So, starting last fall, we launched support for rheumatology, immunology, migraine meds, those meds that folks need to access for pretty much to live, right? To have any resemblance of a quality of life. We achieved about an 80% success rate north of that in that space, and helped a lot of patients get back on guideline directed therapies. And as you mentioned, it's not new to the GLP space, but and it's not unique to the GLP space either, right? So, particularly there's a case I'm thinking of where there's a patient that we helped who has rheumatoid arthritis. CVS Caremark, being the PBM, switched her from a medication called Remicade that she had been stable on for 10 plus years onto a biosimilar that the FDA says is not interchangeable, right? So you can't switch somebody from one drug to the other drug and expect the same results, right? And so we fought that, and actually that case is overturned in less than 24 hours. We have countless of those examples. And so as we were kind of watching from the sidelines, we saw what was happening with the access issues in the GLP space. And frankly, we knew we had to help. So we had a great pattern down, and ultimately, what we're doing here is we're first educating folks that they have a right to appeal, right? Every patient has a right to appeal. And that's codified in law at the federal level, and it's been, duplicated in almost every state. So first and foremost, that's true. Second, if patients, now that they know they can appeal, oftentimes they wonder, how do I even get started?
Right.
And somebody would need to, understand a lot about, insurance policy, a lot about medical evidence, about legal protections, and so on and so forth. And, what we've done is basically take all of our knowledge in those, domains, and all we expect you to come to the table with is just a little bit of information about your insurance company, your health history, in your own words. We do the rest, and then we take, your story, we back it up with all of those sources, and ultimately get you a winning appeal in, 30 minutes or less.
That's amazing. One of the things that I have found in my own personal journey is that primary care providers especially have a hard time fighting these battles. We partner with a company at Roe to help people get access to GLP-1s. Roe is really good at this, and in terms of having to fight this over and over every day. That's sort of what Claimable brings to the table for everyone else who may be working with primary care providers who are not as adept at fighting these battles or don't have the time and resource to fight these battles. There are certain things that need to be said, certain information that needs to be included if you're going to be successful. And what I found most amazing about Claimable is the 80% track record of helping people stay on their medications. And I thought this was created for this moment. Can you tell me a little bit about, in terms of the Claimable platform, just what people can expect when they go there from a time investment standpoint, and why you feel like it's more important that these claims come from the patient and not from the doctor? What about that makes it magical or special?
Yeah, it's a great question, Dave, and yeah, certainly happy to elaborate on that. So, first you touched on primary care providers, or where a lot of these GLP prescriptions originate, right? If you've been to a primary care office, or if you know a primary care provider, you know that they're inundated, right? And they don't have time to simply spend, hours on the phone with the insurance companies, to try to fight on behalf of patients. I know all of them would, and ultimately that leads to provider burnout and so on and so forth. And we could talk about that for a long time. But, ultimately, if you have support from your provider, great. If you don't have support from your provider, that's okay too, right? So as far as what you would need to do to, come to the table, right? So a copy of your insurance card, for most people, that's likely in their wallet, right? A denial letter if you have one. We know that there's 200 and some thousand of these that went out, right? And then, a letter of support from your provider is great. if you have labs to, show like a sleep study, like sleep apnea, as we know, Zepbound is FDA indicated for sleep apnea. So if you have, a sleep study or supporting labs, we certainly support those. If not, that's okay too. So patient would bring those documents to the table. We would ask them specific questions about their, obesity journey, along with their, comorbid conditions and so forth. And really, we also ask a lot of questions outside of like what's in the medical record, right? So tell us about how your health has been impacted. Tell us about your daily chores that you can no longer do. Tell us about why your joint pain doesn't allow you to exercise. Tell us about how you potentially have been passed up for promotion at work because you're too tired to get there, right? And all of those things really kind of humanize the patient. We capture that all in the patient's own words, and then that is all used to support the appeal. And then even beyond the appeal, right? So I think this is a huge differentiator for us. So you mentioned we have an 80+% success rate, which is true. And we feel that patients have unique rights, obviously codified in law, right? But they also have the unique ability to bring other folks into the fold that can be influential in overturning the decision that a provider wouldn't have. And what I mean by that is plan executives, right? Those at the plan that potentially can help influence the decision, overturn the case. Regulators, politicians.
Can I just pause you right there for those? You may have lost a few people there. When you say plan executives, what exactly do you mean? What does that look like in real life?
Great question. So, beyond just appeals at cvscaremark.com or just the general appeals address, we also give you an option to copy the executives in the C-suite, right? To make sure they're aware of how your health is impacted. There's an estimated 55-ish% of the United States is on some type of commercially sponsored plan through their employer. Of those, about 60% are on what's called self-funded plans. What that means is your employer is actually employing the insurance company to administer your benefit, but ultimately your employer is paying the bill. Well, most employers want what's best for their employees for obvious reasons, right? So we also give you an opportunity to copy your employer if you're on a self-funded plan, which we identify. So they are also influential and can, nudge the insurance company to make the right decision.
So in other words, what you're saying, Zach, is if you loop your employer into it, your employer then can become a part of that fight for you and try to make sure that you end up with the coverage that you need for the medication that your doctor decided you need to be on.
Absolutely. Yep. And we have countless cases in that realm. And for the most part, employers don't have a ton of visibility into like how their plans are being administered. They're in the dark. They think everything's okay until they hear otherwise. Well, this is effectively them hearing otherwise, right? Is that, hey, this patient or otherwise your employee has been restricted access to this medication they need to live, a long, healthy life. Can you intervene and help them access? And 9 times out of 10, they help out.
Amazing. So essentially what Claimable brings to the table is you're going to help that person compile all the data that they need to build the case. You're going to then take all the documents, all the verbiage, everything, put it all together in a package, and you're going to make sure then that information is delivered to exactly who it needs to be delivered to in order to get a prompt and thorough review and appeal.
Exactly right.
Awesome. With an 80% track record, I think that could be an absolute game changer for again, hundreds of thousands of people that are facing the CVS Caremark change today. But on a daily basis within the community of GLP-1 users, there are people that are facing losing access, whether it is a formulary change or a plan change, whatever it may be. I think fighting that battle is something that has been overwhelming for people. And I think you've taken the sting and the sort of shock in everything that has to happen to help kind of release people from this paralysis they feel of not knowing what step to take next. Zach, how can people get access to the tool that you have?
Yeah, great question, Dave. And thanks so much. We ultimately want to empower patients. We want to educate them they have rights. We want to help them enforce those rights, and get back on guideline directed therapy, right? So if you go to getclaimable.com/OTP on the pen, you can access ultimately the CVS Caremark switch. So basically what we're doing is we're teeing up a formulary exception, and which, by the way, over 20 states have enacted enacted laws to protect patients from non-medical switches, including the two most populous states, California and New York. So, ultimately we match up with those laws that are protective, as well as at the federal level, right? You have the right to appeal. And then one other thing I want to make sure to mention here is that, CVS Caremark, this isn't new to them, right? So there's a story about CVS Caremark a couple years ago, 2022, where they switched off of a popular important blood thinner called Eliquis. They did a formulary change that affected about 150,000 people. And those folks were forced onto another medication. And within 6 months, CVS actually reversed their decision, right? And that was due to a huge public outcry, provider backlash, and then also reports of, patients with terrible adverse events, even health, heart attacks and strokes.
Wow.
So this isn't the first time, and through a lot of pushback, that decision was ultimately changed. And we believe that this can have the same impact, and ultimately we're here to help.
Awesome. Zach, amazing work what you're doing at Get Claimable. You and I had the chance to talk a little bit about your own personal background and sort of your passion that led to helping to build the tool at Claimable. I hope that maybe we can come back and discuss that at some point too, because I think that's a great story. I just love what you're doing here, and I love that this tool is so timely. So thankful that we were able to connect. Thank you for giving, excuse me. Thank you for giving a little bit of your time here to the OTP community, and appreciate everything that y'all are doing. We'll circle back and chat after hopefully tens of thousands of people are able to maintain their access to Zepbound.
Awesome. Thanks, Dave. Yep, you have rights. Thank you so much. Thanks for spreading the word, and we appreciate you, Dave.
Love it. Thanks, Zach. Get Claimable. Thank you to Zach for joining the podcast today and giving us a little bit of information, timely information, as again, hundreds of thousands of people are facing losing access to Zepbound. And it just doesn't have to be that way. You can fight, and Claimable makes it easy. We've given you some tools to know how to start appeals and everything on our Substack. But I found in conversations with patients who were reaching out to me that just was all overwhelming. They didn't know where to start. And so Claimable exists. We found them a couple weeks ago, and I believe it's about $40 to use their platform, and they're going to just make it seamless. And they're going to within that $40, you're paying for the platform, but it's also compiling this data the way it needs to be compiled and delivering it to who it needs to be delivered to ensure that you have the highest probability at success. So $40, you can save 10% right now using code OTP10, OTP for on the pen. OTP10 will save you 10%. We appreciate Claimable, what they're doing, and I can't wait to hear stories. I know that next week I'm going to have story after story of people who were able to successfully fight their insurance companies using Claimable. So thank you to that awesome team there at Claimable. And bonus, they're located in Iowa, where I'm at. How often does that happen? Not very often. Moving along to Viking Tide. VK2735 has been one of our favorite pipeline medications to track, and on this channel, we've called it Viking Tide. And last week, they took a huge step forward. So Viking Therapeutics launched its phase 3 program for VK2735, which is their dual GIP GLP-1, which is similar to Mounjaro and Zepbound. But Viking Tide is a huge contender because it appears to be maybe even a more powerful GIP GLP-1 combination than even tirzepatide is. So the Vanquish program, which I love the trial name there, Vanquish, it includes 2 trials, one for adults with obesity and one for diabetes. And so they're doing these dual trials, but interestingly, they are doing a oral version and an injectable version. And combine these enrollments, the goal for these enrollments crosses 5,500 participants, which is crazy because you compare that to Eli Lilly, who enrolled around 2,500 people in their Surmount obesity study and just under 1,000 in the diabetes arm. Viking Therapeutics, Viking Tide is going to be big. So really exciting to see that move into phase 3 because VK2735, I think, has the potential to be a game changer. People get really excited about orforglipron, and I think orforglipron, the oral from Lilly, is going to be really exciting, but it's not going to be nearly as powerful as the injectable versions as you get higher in the doses, right? Gets right around, what we saw with Wegovy potentially at the high doses, but TBD. We'll have to see how it all plays out in the real world and how these orals really work. It's a small molecule, so it's kind of the first of its kind. This one is actually a peptide. It's just the oral peptide version of VK2735, the injectable. And it gets me very excited because the weight loss with that numbers way outpaces in the phase 2 trials anything that we have seen with orforglipron. So we'll have to check that out. Super excited about that one. Also, some really interesting news this week on semaglutide. So there's some game-changing news. Semaglutide just continues to prove itself as a molecule. If you've ever lived with somebody who has Alzheimer's or dementia, I think I mentioned in the Substack article that my two grandfathers, I should say, both had Alzheimer's. Just a tragic thing to lose. If you've ever stared at a loved one and just prayed silently to yourself, like, God, please help them remember who I am. Like, this is game-changing information. So check this out. A new study from Case Western Reserve University just landed, and it says essentially that one out of nearly 7 million people. I'm reading here and I'm not doing it well. Out of nearly 1.7 million people with type 2 diabetes, those taking semaglutide had significantly lower risk of developing dementia than those on any of the 7 other diabetes medications that they looked at. So this real world study looking at 1.7 million people with type 2 diabetes, they noticed that those taking semaglutide compared to other diabetes treatment had a significantly lower risk of developing dementia. And this was particularly seen in older population and in women, both populations which are more prone to obviously this disease. But this is the exciting part for me. Later this year, we're actually going to see some results from 2 major clinical trials from Novo Nordisk. So this is a real world study looking at a lot of people. So this is a huge clue that semaglutide can be really beneficial in early treatment of Alzheimer's. But later this year, we'll get some data on the Evoke trials. And these are actually placebo-controlled trials of semaglutide. As Kim pointed out in the comments, this is Rybelsus, the oral formulation, in people with early stage Alzheimer's. And if the results confirm what this observational study data suggests, it will be an absolute game changer for the future of Alzheimer's care. A lot of this is thought to relate to amyloid plaques. It's we won't do a deep dive on what amyloid plaque is, but there's a buildup of this plaque in the brain, specifically in diabetics. You may recognize we've talked about amylin a lot lately, CagriSema, eloralintide. We've talked about the research grade versions creating amyloid plaques and amyloid fibrils. This is similar. It's a buildup of these plaques in the brain that can cause Alzheimer's, or is thought to. And it's thought that potentially what's happening is the mechanism of semaglutide helping with insulin production is helping to reduce those amyloid plaques buildup. And so, yeah, I'm not a doctor, not a medical provider, but that's the way that I have been understanding as I read. And this is a huge game changer if you've ever loved somebody with Alzheimer's. So this is it's always good to bring like exciting, new, fun information that is uplifting, right? Not like hundreds of thousands of people losing access to Zepbound. That's not fun to talk about. But we are bringing solutions today, and we're bringing positive news with Viking Tide, with semaglutide, and now with some validation on this whole concept of food noise. So food noise is what people talk about in terms of of getting on a GLP-1 and having this switch flipped in their brain where they talk about how cravings that used to be just incessant and never went away, like a flip switched, and they just went away. People often say in this community, like, I finally feel like I have space in my head to think about something other than food. That's food noise. That's what we've come to call food noise, this chatter in the brain that makes you think about food constantly. In this new study from Nature Medicine that published this last week, this is all linked on my Substack. You can get that at obesity.news. Just type obesity.news into your browser. It'll take you right there. Put your email in. You'll get these all sent right to your email. But researchers ran a 6-week randomized trial looking at what happens in the brain when people take tirzepatide. But this wasn't just a number on the scale it was looking at. They actually used brain scans, MRIs, to watch what happened when participants were shown images of high-fat, high-sugar foods. And the result at just 3 weeks was that people on tirzepatide had significantly less activation in 4 key brain regions: the orbital frontal cortex, which is the region that is tied to food reward and satiety; the medial frontal gyrus. Sorry, I'm saying medical things, so it's going to be a mouthful, which is responsible for self-generated decision making; and then the cingulate gyrus, which is involved in emotional response and reward conflict; and finally, the hippocampus, which is more commonly talked about, where emotional memory gets stored, including memories of eating food for comfort, which is something that many people, even people that don't live with the disease of obesity, talk often about. Is this concept of eating to sort of feed our emotions. So these are the places where food cravings echo in your brain, and the regions where this concept of food noise likely lives. So when you see a scan lighting up, when these folks were looking at images of cakes and pies and highly palatable food, essentially, what they found is after 3 weeks on tirzepatide, those parts of the brain were significantly dulled. And interestingly, they were also looking at a wing of this study. There's 3 wings: a placebo wing, there was a liraglutide wing, which is Saxenda Victoza, and then there's a tirzepatide wing. The liraglutide didn't really calm these parts of the brain the way the tirzepatide did. So tirzepatide, again, and this sort of plays out in the real world anecdotally within the OnThePen community. You can drop it in the comments if this has been your story, but it's that specific mechanism of that GIP that seems to quiet the noise in the brain. So for those of you who have been talking about food noise and it's only been a concept, there's now some study that probably, like, they're not calling it food noise in this study. But to me, that really seems like what's going on here is we can actually see that food noise in the brain being quieted on MRI scans, which is pretty amazing. The last thing I wanted to touch on was a piece of news this week about mazdutide. Mazdutide. Mazdutide is actually the first GLP-1 and glucagon agonist to ever hit the market, but don't get too excited. It's only hitting the market in China. So here's what mazdutide is. Again, we talked about GLP-1 and glucagon. Survodutide is another drug from Boehringer Ingelheim that'll actually hit the American markets before mazdutide ever would. But mazdutide is actually an asset owned by Eli Lilly, and they've licensed Innovent, a company called Innovent in China, to bring it to market in China. They are doing controlled phase 3 trials here in the United States. Eli Lilly is to potentially bring this to market. But if glucagon and GLP-1 sounds familiar, it's because you've already heard of that in retatrutide, which is GLP-1, glucagon, and GIP. So it's a triple agonist. So retatrutide takes mazdutide to the next level. And so it's not likely that you would see mazdutide come to the American market in a really meaningful way, considering we're going to get retatrutide probably early 2027. I can't imagine that mazdutide would have a huge place, but it could if somebody were looking at survodutide from Boehringer Ingelheim, which will be on the market by that time too. And if they wanted something similar without the GIP for whatever reason, maybe they want less weight loss, but they want the benefit of the reducing of liver fat, because that is really where these glucagon agonists shine, is they seem to just melt away liver fat. And so you can have people even in like later stage fibrosis, which is scarring of the liver, and you can actually see healing being done in these patients taking these glucagon agonists. So that could potentially be a really niche role that mazdutide could fulfill in the United States. But when we talk about weight loss, there was a 48-week study where average weight loss on the highest dose of 6 milligrams saw about 14% body weight loss against, I believe that was about around 1%, maybe a little less than 1% on the placebo. So you're talking about semaglutide, like injectable Wegovy level numbers, because this was at 48 weeks where the Wegovy trials were at 62. You're probably going to see similar weight loss or somewhere between that and tirzepatide. So it won't eclipse or cannibalize Lilly's tirzepatide sales in China, but essentially, it's going to fill a real niche when it does come to market in the United States. So that's the story on mazdutide. It's available in China now from Innovent. It's actually owned by Lilly, licensed to Innovent, and Lilly could potentially bring this to market here. Again, I think to fill those niche roles where people want to reduce their liver fat, but maybe don't have as much weight to lose as they would need to or would with retatrutide. So that's it. That's what I got for you this week. Thank you for being here. And thank you to our sponsor, Ro, for always being such a great partner here. Of course, Ro has a Ro body program. You can check it out at ro.co/OTP. If all these medications sound like, hey, that might be for me. I've been living with obesity. I've been struggling. I've been learning more. I don't know where to jump in. ro.co/OTP. Learn all about the Ro body program, where patients lose 15 to 20% of their body weight in a year, coupled with lifestyle modifications and where appropriately prescribed. But if you're going to get a new medication, you want to make sure you're aware of all the potential side effects. That is all available at ro.co/OTP for OnThePen within a couple of clicks. And you can learn more about the Ro body program there and get access there. They've got the access to the Lilly vials as well on the Zepbound vials. You can do it all through their platforms. Really great. And they're a really great partner. So go give them some love for helping to bring this podcast to you each and every week. Thank you for helping us to continue to do what we do with your likes, your saves, your shares, your 5-star rating and review on the podcast. All of it helps us to continue to build out this vision that I have for an obesity-centric news platform that empowers people every day to have more competent and confident conversations with your doctor. Boy, if this podcast wasn't that, if this podcast didn't arm you with some real tools that you can use to go out and fight for yourself and get the medication that you deserve to treat your chronic disease, I don't know what did. If you found it helpful, please do all the things, hit all the buttons and help us out. Thank you for being here. Thank you for being the best part of what we do at OnThePen. I couldn't, wouldn't, and shouldn't do it without you. Until next week, thank you so much.